Hi, my name is Dr. John McCarthy and I'm a chiropractor here in Cohasset, Massachusetts. And today's video is a video on a concept that we refer to in this office and in the type of work that we do as Houston control. Now, what is Houston control? Why is it important? And why should you know about it? Houston control is a concept that illustrates the importance of your spine and your nerve system in your body's ability to heal and recover from sickness and disease, as well as to achieve and maintain an overall good state of health. What I'm going to draw for you here on the board is my artistic rendition of the base of your skull. Now, your skull and your spinal column, major purpose is to house and protect the nerve system. So what you're looking at is from this vantage point, you have the base of your skull, you have your atlas and your axis, and you're looking at the spine from the back as it descends down the spinal column. Now, as I said, the skull houses and protects your brain. And your brain is split into two lobes. And all of the nerve tissue that leaves your brain has to exit through one hole in the skull, the foramen magnum. And this area of your nerve system is referred to as your brainstem, which transitions down into your spinal cord. Now, this nerve tissue right here is protected by the first bone in your spine, called your atlas, or also referred to as C1, and the second bone in your spine, axis, or C2. Now, the nerve tissue in the core of your brain is white matter. And the outermost layers of nerve tissue in your brain are gray matter. Interestingly enough, the reverse is true in your spinal cord. The innermost layers of your spinal cord are gray matter, and the outer layers are white matter. So at some point, the gray matter has to cross from the outside to the inside, and vice versa for the white matter on the inside to the outside. Where does that occur? Well, white nerve tracts come down on the inside and they cross over to the outside in a region of the nerve system known as the medulla oblongata, which is the lower portion of your brainstem. The gray matter comes from the outside and crosses over to the inside, so that you have a confluence of fibers right here in the medulla oblongata of your brainstem. Now, the reason we call this area Houston control is because these nerve fibers go to every single cell and organ in your body. Your liver, your heart, your lungs, your kidneys, your digestive organs, your reproductive organs. You can in fact have a spinal cord injury or be shot through the spine and live. You can even be shot through the brain and live. But severe traumatic injury to the brainstem and it's lights out. This is the seat of all vital functions in your body. Your cardiovascular system is controlled by your brainstem. Your hormones, your sleep cycles, your appetite, your respiratory rate, all your autonomic function are all seated right here in the brainstem. So what can happen is this bone right here, your atlas, your C1, can actually misalign and put pressure onto your brainstem. What happens? You get dysfunction in your peripheral organs. That's why we call the brainstem Houston control. Now, what chiropractors do, and what we do here in this office, is we specialize in detecting what we call, in chiropractic science, vertebral subluxations, which are when the bone misaligns, puts pressure onto the nerve tissue, and interferes with the nerve communication from the brain to the body, and body back up to the brain. If you know someone, or you or yourself, are suffering from a chronic health condition and haven't seen the results that you've wanted to with whatever methods you tried, I encourage you, find out if you're a candidate for chiropractic care. Reach out to me, give our office a call, and we can talk and find out whether or not you could benefit from being checked for vertebral subluxations. Thank you.